Hi, my name is Dr. Ashley Izadi, and I'm so glad you made the decision to learn more about aligning your teeth with Invisalign at our dental practice. I hope you find this video that I made for you valuable in learning more about the Invisalign process and the tremendous benefits that come from a well-aligned smile. I'd love to tell you a bit more about our practice. My husband and I operate two practices out of one location, Valley Dental Health and Advanced Dental Health. Valley Dental Health focuses on family dentistry, while Advanced Dental Health focuses on more specialty level treatments. The great thing is that regardless of your treatment needs, they will be coordinated seamlessly by our team in one convenient location. We established our practice over 8 years ago to provide a dental experience that is different than any other experience you've ever had. Our Google reviews will show you that our patients agree, and we were also voted one of Baltimore Magazine's best workplaces in 2019, so our team agrees as well. Our office is a place of joy, laughter, and smiles. We believe in listening to every patient's story and tailoring treatment specifically to fit each person's needs. We use modern techniques and technologies that make our treatments more effective and ultimately make for the awesome experience we want you to expect every time you see us. One of the newest additions to the VDH experience is incorporation of virtual care and video consultations. This allows us to address many aspects of treatment without an in-office visit, which is important to so many people, especially right now. This will be an optional feature in your Invisalign treatment. Now, a little bit about me. I graduated from the University of Maryland Dental School in 2005 and attended a 2-year residency in advanced dental dentistry, where I served as chief of residence and honed my skills in advanced full mouth rehabilitations, dental implant surgeries, endodontics, and other advanced dental therapies. After residency, I have sought out advanced training in IV sedation techniques, dental photography, and digital smile design, cosmetic dentistry, and Invisalign. I've been in practice now for over 13 years. The greatest joy I have in dentistry is providing my patients with the convenience they need to let their full smiles shine. I believe that a confident and healthy smile allows a person to achieve their full potential in life, and it is such a gift to be able to help people with these goals. Invisalign is such an amazing treatment to help patients with their smile goals, and it's something I am so passionate about. In 2019, I was honored to receive the American Academy of Clear Aligners Golden Aligner Award, given annually to the dentists with the top Invisalign treatment in North America. I have also been recognized at various Invisalign meetings for outstanding treatment outcomes for many of my other cases. So I'm really excited to tell you a little bit more about Invisalign and what we can do for you. The reason I'm so passionate about clear aligner therapy is because we know that aligned teeth are easier to clean and actually do a better job of cleaning themselves while eating. We also know that aligned teeth provide for better function and also better support for your bite. And well-aligned teeth are more likely to last a lifetime. Ultimately, you can smile, talk, and eat more comfortably and healthier with well-aligned teeth. I have seen so many of my patients return after their treatment is complete to tell me about the wonderful changes that have taken place in their lives since aligning their teeth. Everything from marriages to new jobs to better outlooks in life. When you experience these changes firsthand, it's hard not to be passionate about this treatment. I think it's really important to discuss Invisalign compared to some of the other clear aligner treatments that are available to consumers. I work with Invisalign because I believe in their process and in their system. Invisalign is the pioneer of clear aligner therapy, allocating significant resources to research and development. And they continue to bring new techniques and technologies to the market, improving the lives of thousands of dentists and millions of patients along the way. Their smart technology is incorporated into the attachments, into the material of the aligners themselves, and also into the algorithm that guides our Invisalign treatment plans. There is no doubt that if I needed clear aligner therapy, I would want Invisalign. In fact, I did need clear aligner therapy and I did use Invisalign, and then I treated my husband too. So now let's talk about the process. Once you've decided to move forward, we'll set up a records appointment. During this appointment, we will complete documentation that I need to formulate a custom Invisalign treatment plan for you. This includes an iTero intraoral digital scan, which just takes a few minutes and replaces the goopy impressions that no one likes with a much more accurate digital impression. This scan will also provide a simulation of your expected outcome, which we can email to you so you can share with your friends, family, and coworkers, and you can all be excited together. We will also take a series of photographs and x-rays as needed. If you are due for a hygiene appointment and dental examination, this will be completed as well. It's important to remember that most dental treatment needs should be completed prior to starting Invisalign treatment. We will help you and guide you with that. Once we have all your documentation, your case as well as my treatment recommendations will be submitted to Invisalign. Using a 3D model of your mouth and my recommendations, an initial treatment plan is created, which I then modify to suit your treatment goals. This process usually takes several weeks to complete because I request modifications until the treatment plan is as perfect as I can get it. Then we order your first aligners and book you for your first appointment, which will be 1 to 2 hours long depending on your treatment needs. Any subsequent office appointments will be approximately 30 minutes. And generally, in-office appointments will be about every 6 to 10 weeks depending on your treatment needs. Some of your appointments will be in the office and others may be over video conference if needed. You may also receive video messages from me regarding your treatment. But no matter what, you will send me a picture of your progress through a virtual consult platform using the My Invisalign app. I will be giving you your own set of cheek retractors and an awesome smartphone selfie ring light with instructions on how to take selfies for me to track your progress every week. I love that I get to monitor your treatment using this platform. And you're going to love your smile so much that I'm sure you'll be getting plenty more use out of the ring light. Most of my treatments are completed within 6 to 12 months. This is what the aligners look like. They are thin, so they are comfortable and nearly invisible, but they are rigid, which allows them to get the desired results. You'll see interesting spaces incorporated into the aligner. These are called attachments, and they are bonded composite filling material that allows the aligners to produce more efficient movements. This is one of the biggest reasons that Invisalign stands out above other similar clear aligner technologies. These attachments are what allows Invisalign to achieve the results we can. We will bond them to your teeth on your first treatment day, and we will remove them when you are ready for your retainers at the end of your treatment. Tooth slenderizing is also a part of most Invisalign treatment plans, and is another part of the Invisalign process that sets it apart from others. Slenderizing allows teeth to move past one another and also provides for more stable contacts between teeth that help to prevent future shifting. I will do this slenderizing for you utilizing something similar to sandpaper for teeth. Remember, there's no pain. Once you start the Invisalign process, you will be wearing the aligners 22 hours a day. Since you can take the aligners out while eating, you can eat pretty much whatever you want. You just need to remember that after every meal, you must floss and brush your teeth immediately and thoroughly so you can replace your aligners. Keeping the aligners clean is easy. Just brush them like you would brush your teeth. Also, you can drink anything with your aligners in place as long as it is clear and sugar-free. I'm happy to tell you there is typically no pain associated with Invisalign treatment. You will experience tightness or soreness, especially when changing into a new aligner. I'll often compare it to putting on a freshly dried pair of jeans. They might feel snug at first, but after a little while they feel just right. And that's why I ask my patients to start wearing new aligners just before bedtime. You'll change your aligners on the same day of each week on a schedule that I will provide you. You'll be able to verify the schedule on a convenient smartphone app called the My Invisalign app. But we will also make sure to write down the wear date for each aligner on the aligner packaging. You'll get the full white glove service. You should always start wearing new aligners just before bedtime to allow a full uninterrupted evening of initial wear, 8 hours minimum. And like I said earlier, putting on a new aligner before bedtime allows you to sleep through most of the initial tightness. I'll be providing you supplemental chewing devices to improve your outcomes in your Invisalign starter kit. These devices will ensure that the aligners hug the teeth the way they are designed to. They also decrease soreness and increase predictability of your treatment. It's important that you chew on these devices 3 times a day for 10 minutes each time. It's super easy to do. In some cases, I will recommend vibrational device to facilitate your treatment, which we will discuss if necessary. We lay the foundation for your treatment during the first appointment. During this appointment, we will bond all the attachments, and if tooth slenderizing is needed to facilitate alignment, it will also be completed at this time. Depending on your individual needs, slenderizing may be necessary at other times as well, and I'll take care of that for you. Sometimes treatment consists of 2 phases. After the initial phase of treatment, I will evaluate your outcome and compare it to the anticipated outcome. If there are any fine-tune adjustments needed, we will perform new diagnostics, a new scan, and new photographs, and we will initiate phase 2 of your treatment. Phase 2 is similar to phase 1, but usually shorter in duration. It's super important to remember that your teeth are constantly shifting. Even after we shift them into proper locations, they will tend to shift back. This is why all orthodontic treatment should be completed with retainers. I joke with my patients who ask, how long do I have to wear my retainers? By telling them, as long as you want to keep your smile. Retainers are really the most important part of keeping the results of your treatment. And all of my patients finish with one of various appropriate retainer devices. It's also important to remember that after your Invisalign treatment is complete, routine dental preventative visits are still vital to your health and your smile. So make sure to schedule all of your preventative appointments with Valley Dental Health. Your last Invisalign appointment is special. You will have just completed a journey to a smile you've always wanted. We make it even more special by commemorating it with a photo of you and your dental team in our photo booth. Something all of my Invisalign patients look forward to, and so do I and my team. It's really a fun day. I want to tell you about the financial commitment and what's included in the Invisalign package. The total cost of treatment is $5,500. Your treatment, as well as any fine-tuned adjustments needed, are all included. Additionally, all diagnostics, slenderizing, chewing devices, and an appropriate retainer for your treatment are also included. All visits, both in-office and virtual, are included in your treatment. The selfie ring light is yours to keep and use over and over and over again as you share your new smile with others. Finally, I like to add at-home professional whitening that you can use inside of your aligners at the end of your treatment to give your smile that extra wow factor. We have partnered with Care Credit to provide a flexible option that is interest-free for 24 months and will cost less than $230 a month. Care Credit also offers a financed option for 5 years for $140 a month. Both of these options come with no prepayment penalties. Your third option is 6 equal monthly payments less than $600 each with a $200 initial deposit. An option to pay your treatment in full is that you will get a 5% discount. We want to make sure this amazing treatment is accessible to everyone in our community. A member of our administrative team would be happy to discuss these options with you at your first appointment. Thank you so much for taking the time to watch this video I've prepared for you. I hope I've answered all of your questions, and I encourage you to reach out if you have any questions. One of my greatest joys is seeing generations of families seeking to improve their health and their smiles through clear aligner therapy. I've treated mothers and daughters, husbands and wives, and siblings, all eager to push each other to achieve the smile goals they've always wanted. And they take me along for the ride. I'm excited to start this journey with you. I can't wait to take a selfie with you and my team with your beautiful new smile. Thank you so much. I hope to see you soon.